it's very near and dear to my heart because I see these people who don't do education, and some of them have great, glorious birth, and it's wonderful. But then I see the people who do, and they go into the births and they're not scared and they're not anxious, and they just completely rock it, and they have these such positive experiences. And your birth, like I said, is such a important event in your life, and it can really set you up for your whole motherhood and your whole life. I mean, if you have a really traumatic birth, it can really take a toll on you. So just being educated and knowing what you're getting yourself into is like so important.
Thank you for joining me today. My name's Krista. I'm from Mommy Knows Best, and I'm here again with Liesel Teen, who's going to be talking all about her new course that she's actually offering, all about birth education and the natural birth as well. So thank you for being here, Liesel.
Yeah, thank you for having me.
So for anyone that either didn't see the previous video with you or is unaware, can you just tell us a little bit about yourself again, what you do?
Yeah. So my name is Liesel. I am a labor and delivery nurse and mom from Raleigh, North Carolina. I work kind of part-time hours now. I kind of stay home with my son during the week. And I have a blog too. I have a blog and Instagram, and I do a lot of pregnancy, breastfeeding, labor and delivery education on there. I've always kind of been more interested in like the educational aspect, so I kind of went off and did my own thing with my blog. So yeah, that's me, and that's kind of what I do.
Awesome. So just to like dive right in, what would you say is the importance of having a birth education?
I think you kind of have to look at it in anything you do in your life, whether you go on vacation or whether you go skydiving or whatnot. You don't want to go into something without any knowledge about it, right? And you kind of have to look at that like birth. The birth of your child is one of the most important events in your life, and many women have all this fear and anxiety kind of surrounding it because I just posted about it yesterday. It's in the media, or your friends and your family tell you, how scary it is or whatnot, or their experiences. And one way to really help that fear is to educate yourself about it. So I'm going to talk a little bit more today about the importance of birth education when you're planning on like going natural, like without getting an epidural. But it's certainly important for everyone. Because even with an epidural, there are, obviously epidurals aren't guaranteed to. So, you go and maybe you plan on getting an epidural and, things don't work out. But especially if you are planning on going natural, there's a lot to that. And I have patients come into triage all the time who desire, natural births, or they want to try and go as natural as possible. They don't want to get epidurals or IV pain medicine or anything. And the ones who are successful and the ones who have these like crazy, awesome, amazing births are the ones who have done their education. Whether it's taken one class or reading books or, talking to a bunch of people or doing podcasts or listening to podcasts or whatever, they've done all this education about what they're getting themselves into so they feel more mentally prepared for it. And usually they wind up to have, great experiences. It's these people who come in and they say, oh yeah, I really want to go natural. I don't want to, get an epidural or whatever. But when I ask them, have you done any education about it? They say, no, just kind of wing it. And, some of them are fine. It goes quickly, and, we support them through it as nurses, and they are able to have, a great birth. But so many of them just don't know what they're getting themselves into. So, they wind up getting epidurals or C-sections, and not that epidurals or C-sections are bad. It's just they wind up having an experience that they weren't planning on having. So it's important, like I said, with anything in your life, if you're going into something that you don't really have too much knowledge in, it's important to kind of do your education on the front end. So
yeah, absolutely. Yeah, it definitely makes a lot of sense when you put it that way too. It's like you don't, especially nowadays, you don't want to go do anything without doing your research ahead of time, making sure you're prepared. About how much time up to now until their birth do you think they should have established that they're going to do a natural birth?
So I will just speak from personal experience. What I did, I probably, when I first got pregnant, I wasn't like gung-ho, I want to go natural or whatever. I probably got really interested in it maybe when I was 5 or 6 months, and then I just started kind of reading stuff, reading a few books, reading resources, talking to people at work, watching birth videos or listening to podcasts and stuff. And I just kind of surrounded myself with that information. But I would say the earlier the better. But you don't want to do all the education up front and then not have a refresher or anything at the end, because you might forget a lot of stuff. So I would just say, as soon as you kind of get interested in it, engulf yourself into it and just do as much research and education as you can. With that said, if you are 39 weeks pregnant or 40 weeks pregnant and you're like, this sounds really good, I think I might want to go natural, like, you definitely can binge watch a bunch of stuff in one day and like learn what you need to do and change your mindset and know exactly what you need to do to go into your birth. So I would say it's probably better to do it months before, but if you only have a week, you can do it in a week.
And is that something that you would have established then with your doctor too? Like, as soon as you decide, you should call them and be like, hey, I want a natural birth?
Yes, so that's really important too, and I talk about that in my course too, is the importance of having a provider that agrees with what you want to do for your birth, whether that is going natural or whether that is having a C-section or whether that is having an epidural. It's really, really, really important to establish practice with a provider who is on the same page, because there are certainly providers out there who are like, their epidural rates are 90%, and they just, that's not really on their plate. They only take care of women who are, just really into epidurals, or they do, their C-section rate is 50%, which, that's fine for some people, but there are certainly providers out there who are a lot more open to, the natural stuff. And it's important to know that in many cases, you can change your provider. So even if you are, 35 weeks or whatever, like, don't be afraid, unless it's for insurance purposes or unless it's for like military purposes or something, you really feel stuck. Then it's important to have like a good solid birth plan going into your birth. But yeah, it's very, very important to establish practice with a provider who you not only you trust, but also aligns with, your wishes about your birth.
I know you kind of answered this, but so did you had a natural birth?
I did. Yeah. I just talked to, I talk about it a lot, but I just talked about it the other day. I was on a podcast just, telling about my birth story. Yeah, I did. And I consider my birth a natural one because I just didn't get an epidural. I went into labor spontaneously and I labored without Pitocin or anything. I was like a couple of days past my due date, but I did get IV pain medicine and I did try the nitrous oxide, but I didn't like it. But yeah, it was great. It wasn't so great when I was doing it because, it was very painful, but just afterwards, and this was another benefit that I forgot to mention, is the transition from so much pain, going through labor, pushing is very painful, lots and lots of pain, and then you have like ultimate joy. Like that transition right there, it gives you like a crazy high, like adrenaline high. Like you feel like you're on like cloud 9. And I'm sure that people do experience that, when you get epidural. I've seen people give birth to epidurals. They're like, oh my God, crying crazy. Of course, it's the birth of your baby. But I know I experienced that firsthand, that crazy, like you feel like you're high. That's the best way that I can describe it. You just go from such a crazy, like painful experience to like a joyous experience so quickly. And your brain is just like what? This is crazy. So that, yeah, it was great. The children that I have in the future, I will do the exact same thing because it was wonderful.
So what's something, and I'm sure this is something you cover as well, but what's something that you wish you would have known when you were giving birth to your son that you know now?
Yeah, geez. I think I wish I had known. So my baby was OP posterior, and that just means that he was sunny side up. He didn't come out that way. He kind of spun, and then he came out facing down. But I think I wish I would have known that that wasn't as much of a mental block as it needed to be. So I was very, very focused on his positioning during labor and my back pain, and um, I was just, I wish I could have just avoided that, mentality of feeling stuck. Cause I really throughout my whole birth felt like, oh my gosh, he's OP. I'm not going to be able to push him out because he's sunny side up. It's a lot, I just know those kind of labors, they're just a lot longer and they're a lot more difficult, and the pushing is a lot more difficult. So I wish I would have known that, like, it's, you got to get rid of those mental blocks. And I think it would have made my labor, a much more, it was a positive experience, but it would have made that mental block go away. So I would say don't focus. If you have negative energy, you have mental blocks during your labor, like try to just eliminate them and get through labor. And then, whatever it may be, whether it's, you're worried about paying for your hospital bill, or somebody's in the room with you that you don't want to be with, it's any kind of negative energy, like get rid of your negative energy and focus on labor, and then worry about it later, or don't worry about it at all.
Like, I just want to jump right in then and just tell us all about the course that you just launched.
Yeah, so I launched my course. It's called Birth It Up, and it probably will take you about 3 hours if you completely binge watch it in one session to do. And it's a birth educational course. I launched it about a month ago, and it is tailored towards people who want to kind of go more natural. We do talk about epidurals, and we do talk about C-sections, and we do talk about pain medicine, all of that stuff, because I know there are people out there who are going to take my class and wind up getting epidurals. I didn't want to make a class that was completely, anti-epidural, because there are a lot of birth education classes out there that are very, like, natural based, but they don't talk about epidurals at all. And it's like, I wanted one that was tailored towards people who wanted to go natural, but here's also education about epidurals in case you do end up getting one. So it is much more for people who are going natural. We talk about anatomy and, what you need to know just about birth anatomy and all of that good stuff. And then I teach you about coping mechanisms and really how to deal with the pain and how to deal with contractions. Then we talk a little bit about, postpartum and a little bit of the aftermath kind of stuff. And it's super cheap. That was also really important for me to keep it well priced, because I see all these birth education classes and they're like hundreds of dollars, and I didn't want somebody to go to my page and be like, I want this class, but I can't pay for it, because I know what that feels like. I know what it feels like to go somewhere and want something and not be able to pay for it. And birth education is so important, and I really feel like, it shouldn't just be for people who can afford expensive classes.
So how do you have your course set up? Is it like videos? Is it lessons? How do they go through it?
It's videos. I don't even know how many lessons I have in there, 30 or something, like something crazy. But I have videos for almost every single one of them, and then it's like text underneath too that you can read. So I usually say, watch the video and then kind of go through the text. But I've had people just go through and watch the videos. But yeah, it's kind of both. I know some people like to learn with somebody just sitting there and like talking to them, and then some people are like, I just want to read a book. So it's kind of both.
So what would you say are your goals of this course? What do you ultimately want to establish with this?
Yeah, so I would say, keep educating the public. I mean, that's kind of what I've talked about this whole time, but yeah, I mean, education is so important. And if I can, my whole goal with this whole blog thing and Instagram thing was to educate. Just if I could just get one person educated and have a better birth, like, my job is done. And so that's just kind of cascading onto this class. Now I'm able to, reach so many more people and educate so many more people.
If you could make sure, like, the moms watching only remembered one piece of information, I kind of have a feeling I know what you're going to say, but could only gather one piece of information from what you're saying today, what would it be?
So I think you know what I'm going to say. I'm going to say, of course, educate yourself about your birth.
Yes.
Yeah, stay educated. I think it's so important, guys. I mean, it's very near and dear to my heart because I see these people who don't do education, and some of them have great, glorious birth, and it's wonderful. But then I see the people who do, and they go into the birth and they're not scared and they're not anxious, and they just completely rock it, and they have these such positive experiences. And you know, your birth, like I said, is such a important event in your life, and it can really set you up for your whole motherhood and your whole life. I mean, if you have a really traumatic birth, it can really take a toll on you. So just being educated and knowing what you're getting yourself into is like so important.
Do you recommend, like, when someone wants a natural birth to get a midwife, or like what's the process, or a doula? I don't know, what's the process for or recommendation that you would say for that?
Yeah. So I will also tell you that midwife is not similar to an OB, but it's a practitioner. So it's somebody who sees you during your prenatal care and they deliver your baby. A doula is somebody who helps you emotionally and throughout your labor support. They help you with position changes. They help keep the atmosphere really positive. So yes, and that's one thing that I say in my class. I have a whole little section on doulas and how important it is. A service, so you do have to pay for it. If you're able to, sometimes people are able to get I don't know what it's called, subsidies, or like they're able to I think it's kind of like I forget what it's called, but you get it covered, you know, like for your job or whatever. You can get like doula services covered, but a lot of people can't. They have to pay out of pocket. So I say yes, like having a doula is really important for a natural birth. You can do it, obviously. I had one of my friends there, but you can do it. I've seen plenty of people do it without doulas, but it is just another like element to everything, and it can definitely make your experience more positive and make your chances of having a natural birth, you know, go up. So yes to doula. And as far as midwives go, I would just say a lot of times people think midwife, you know, you go with a midwife if you want to have a natural birth. And that's not necessarily true. I would just encourage people to find a provider that they trust, whether it's an OB or whether it's a midwife. It's more important to find a practitioner that you trust, regardless of if it's a midwife or an OB.
Mm-hmm. More, again, back to like doing your research and really understanding that person, what their beliefs are and what they want to actually do, less the title of the person, right?
Exactly.
Awesome. So seeing it, like, I mean, I've been, you know, seeing your course be posted all over. It looks really awesome. I feel like the feedback you're getting is really great. So after this, I mean, do you have plans of doing another course or launching other topics? Yeah.
So one thing that I know I'm definitely going to do is in a couple months, I think I'm going to hopefully launch it in May. That's my goal. We'll see how it goes. But in May, I'm going to come out with a class that is very similar to Birth It Up, but it is more tailored towards moms who are really just planning on getting epidurals and still want birth education. So if you are a mom and you are like definitely wanting an epidural, I think you would absolutely still benefit from this class. But I do want to make one that is more just we talk about pain and we talk about coping mechanisms and all of that stuff, but I just have to kind of teach it a little bit differently, and I have to change a little bit of the information. So that's my plan, is to have 2 courses. Like when somebody lands on my page, it's like, okay, are you kind of more thinking you want this type of birth, or are you kind of more thinking you want this type of birth? So that's the plan. We'll see how it goes. Hopefully it's going to be May, but it might be June. Hopefully it's going to be May though.
So finally, can you just tell everyone where to find the course and where they can sign up for it or get more information?
Yeah. So I am most active on my Instagram. I am at mommy.labornurse on there. I will leave a link below. My link is too long to say. I'm most active definitely on my Instagram, and that's where I talk about it a lot. And I have links in there on there and stuff. And I would say just even if you can't spend any money, like just follow me on Instagram, because I provide a lot of educational stuff on there, and just even some of just my pictures like can help you with what you're about to go into. Thank you.
Awesome. Well, I mean, I know I learned a lot, and I'm sure everyone watching will learn a lot too. Thank you so much for, answering all my questions today. Go check out Liesel Teen. And if you're currently pregnant, definitely check out her course, because I'm sure you're going to learn a lot. So
yeah. Thanks so much for having me.